Dr. Swati Naik and you're watching us live on MCure AICOG TV from Bhubaneswar. I'm pleased to have with me Dr. Alpesh Gandhi, who is a Vice President of Foxy in 2013. Thanks a lot, sir, for joining us on our TV show. Sir, we are going to have a talk with you on obstetric HDU and ICU. I think ICU is a terminology very well known to all of us as a medical clinicians, medical fraternity, it is known, but HDU is something, a new terminology that I think we are coming across. So what is HDU?
So basically, I would like to first address what is obstetric ICU. ICU, we all know about the ICU, but obstetric ICU is something which is dedicated to only for the obstetric patients having medical complications or obstetrical complication or surgical complications, and obstetrician and medical and paramedical staff are trained and experienced in obstetric pathophysiology. So they are taken care better. They like MICU for medical ICU, like SICU for surgical patients, like NICU for neonatal. This is new concept OICU for the obstetric patients, and HDU is the concept, is the terminology used for the, it is high dependency care units. So particularly when there is ICU, the treatment is very little bit costly, and for smaller setup or smaller town it is not possible, not viable to have ICU at each and every places. We require certain number of patients to run the ICU, so certain number of deliveries are required, then only ICU can be viable. So this is a terminology where high risk patients are admitted, which if taken, if proper and obstetrical care, quality care is taken, then they may not need ICU admission.
Absolutely.
So this is something intermediate care units between the routine ward and ICU. In ICU, nurse and patient ratio is usually 1:1, whereas in HDU it is 1:2. So for 2 patients, 1 nurse is there. And in ICU and HDU, at both the places, obstetrician is round the clock available. But anesthetist is always there, or critical care specialist is always there in ICU, whereas he or she may not be there in HDU, or but she or he may be there on available on phone call or assurance. Assurance service is there. So, and one more thing is, in ICU we cannot keep a neonate with mother, whereas in HDU breastfeeding is possible. We can keep neonate with mother. So basically in both the places, HDU, ICU, there is a continuous care, antenatal care, postnatal care, intranatal care is taken care by the same team in same place. So mother is and relatives are little more comfortable. Whereas in MICU, SICU, we have to seek the patients at other places. So this is a new concept, but HDU is basically either it is known as intermediate care units or step up units, where they develop complications, critical complication may be shifted to ICU, or critically patients when improved directly sending to routine ward, they are first they are shifted to ICU from ICU to HDU, and then to routine ward. So we can say it's intermediate unit or step up units or step down units.
Okay.
So something care intermediate.
That sounds quite interesting, sir.
Yeah.
So what do you think, when is and why is it needed?
So see, at present, what is the, I would like to narrate my one experience. A patient, pregnant lady was admitted in SICU, surgical ICU, with 25% burns, and she complained that she had abdominal pain. So they called me, and when I had gone there and I had examined, I informed that she has, and we all know that when patient is having burns, she may develop premature labor pain. So when I informed them that she is having a premature labor pain and she will be delivered in half an hour, so all the staffs and doctors were not ready to keep her there. So they told me, you please take her with you, and I requested, but they were not ready, and ultimately while transferring her to obstetric, in the ambulance she delivered. So something is not possible, and that is why these all units are needed. First thing is, it's a part of obstetric department. So when shifting is required to labor room or obstetric OT, it will be a smooth and easily. Second thing, NICU will be with OICU. It is not in case of MICU or SICU. So neonatal care will be taken easily. One more thing is, as I informed you, the obstetrician and staff, medical staff, nursing staff, all are experience with the obstetric complications. And one more reason for this is this setup is the neonatal care, breastfeeding care, all is possible. Whereas one more important thing is in obstetric ICU, the cot can be converted into labor table, which is not there. This facility is not there in MICU or SICU. So that is why this is very much required.
Right.
HDU ICU.
So you see that there is definitely scope for it for the
Yeah.
betterment of the maternal
Yes.
health.
Yes.
Okay. So would you like to give a one-liner message to the fellow obstetrician and gynecologist for this
So
special care?
one-liner message is it is the need of the hour across the world. ICU and HDU are there, but in India this concept is not there. Now with the many government schemes like Janni Suraksha Yojana and many things, previously 50% deliveries were happening at home and 50% at hospital. So at that time our priority was to bring more and more women, pregnant lady to hospital for hospital delivery. Now with many schemes and with the Foxy's efforts, now 85%, 86% women are delivered at hospitals. And now maternal mortality rate is somewhere between 150, 160. So if we want to cut it down more, now our priority should be changed, because now women are dying at our hospitals.
Absolutely.
And for that, this quality obstetric healthcare is required. This is the vital backup, this is the facility, this is the infrastructure, this is 24 hours monitoring facility with immediate life-saving measures. And that is why it is the need of the hour, and definitely with this we can stand up by the other developed countries world, and we can bring down the maternal mortality and the neonatal mortality further.
Absolutely. As you stated, sir, that it remains as an intermediate mediator between an ICU and a routine ward care. So it would definitely help to betterment of the patient's care. Thank you so much for
Thank you.
joining us on MQR ASUG.